My warm greetings to one and all participating in this virtual presentation. In the following presentation, I'll be talking about how acoustically driven microbubbles enable us to achieve targeted delivery of microRNA-loaded nanoparticles to spontaneous hepatocellular carcinoma in canines. So let's begin with a brief note on hepatocellular carcinoma. Hepatocellular carcinoma is a primary liver malignancy in humans with less than 10% survival for 5 years, which clearly indicates the current therapeutic approaches are inefficient with poor prognosis. In the quest for alternative therapeutic strategies, microRNAs have emerged as an efficient therapeutic approach. MicroRNAs are small non-coding RNAs of 18 to 22 nucleotides that regulate gene expression. In HCC, microRNA 122 is downregulated, whereas microRNA 21 is upregulated, which promotes HCC growth and metastasis. Thus, delivery of microRNA 122 and antagomer 21 is an efficient therapeutic strategy against HCC. And to deliver these microRNAs, we adopt PLJ-PEG nanocarriers. PLGA and PEG are FDA-approved polymers, and the nanoscale dimension of these polymeric nanocarriers also enable us to manifest the benefit of EPR effect. As a result of EPR effect, enhanced permeation retention effect, the nanoparticles selectively accumulate in tumors and have found enormous application in cancer therapy. Unfortunately, it has come to an understanding that EPR effect in tumor is selectively limited by factors like abnormal tumor vasculature, high interstitial pressure, tissue stress, and abnormal EC. So in order to revive the scope of nanoparticles in cancer therapy, we need a strategy to overcome these limitations existing in the tumor tissue. And thus we found a solution in the ultrasound-guided cavitation of gas-filled microbubbles. Assuming this is the blood vessel in the tumor, after microbubble injection, we have microbubbles circulating the blood pool. Followed by this, we also inject the nanoparticles, which is the purple small dots moving over here. So when an ultrasound is applied in this region, the microbubbles in the vessels undergo rapid contraction expansion, in other words, cavitation, which exerts high pressure waves to endothelial cells lining the blood vessels and pushes them to create transient gaps. The nanoparticles present in the blood vessels at this point move out of the vessel to accumulate in the tumor. To sum up, we use ultrasound microbubble strategy to deliver microRNA 122 and antagomer 21 loaded PLJ-PEG nanoparticles to HCC tumors in canines. MicroRNA loaded PLJ-PEG nanoparticles were synthesized by water in oil and water double emulsion synthesis procedure. Extreme sterile manufacturing practices and protocols were followed. Size distribution and microRNA loading efficiency of the nanoparticle was also estimated and documented for each stock patient. The treatment was one-time point procedure. The tumor locations were identified under ultrasound scanner, and the transducer was positioned so as to have the target treatment region over the tumor. After positioning the transducer, the dogs were infused with microbubbles and microRNA-loaded nanoparticles intravenously, and at the same time, the therapeutic sequence of the ultrasound was simultaneously applied on the tumor region during infusion. 24 hours post-treatment, the small section of the tissues were harvested and analyzed for delivered microRNAs. Quantitation of microRNAs indicated highest delivery levels in ultrasound-treated tumor regions compared to untreated liver tumor tissue. Likewise, the normal liver tissue had only 33% of what was delivered to the treated tumor region. And this trend was consistent for both microRNAs in all 3 dog patients included in the study. Thus, with the combination of ultrasound and microbubbles, we could precisely control the region of nanoparticles delivery. We also assess the effect of microbubble cavitation on nanoparticle release from blood vessels by ex vivo histology. Histology of the blood vessels in the ultrasound-treated region and untreated control region is shown in Figure 1, insert B and D. The green fluorescent outline denotes the endothelial cells lining the blood vessels, and the yellow speckles in and around the blood vessels depict the nanoparticles. So as we could see here, the ultrasound-treated region definitely has high concentration of nanoparticles as compared to that of untreated region. And the concentration is much higher in the region close to the vessel and declines gradually as we move further away from the vessel. This is an evidence of the fact that ultrasound-triggered microbubble cavitation led to extravasation of nanoparticles into the surrounding tissue. Furthermore, H&E staining of the ultrasound-treated tumor tissue is also shown in Figure 2, insert G, where we did not see any instance of damage to the tissues or the endothelial cells lining the blood vessels, which validates the safe ultrasound operating parameters for clinical translation. Another interesting finding in this study was that the treatment also triggered a cytokine storm accompanied by increased prevalence of CD8 positive T cells in the ultrasound-treated tumor tissues, which hints to a hallmark signaling cascade for cold to hot tumor transition. To sum up this study, the study lays the solid foundation for safety and efficacy of ultrasound-guided precise delivery of nanoparticles in dog patients, which has anatomical as well as pathological similarity to humans, and thus it opens up a prospect for smooth transition of this approach to human clinical trials. With that, I would like to conclude my presentation. And finally, I would like to thank my mentors, collaborators, and team members for their invaluable contribution to this work. I would like to take this opportunity to extend a special thanks to Focused Ultrasound Foundation for, for their support. Thank you.